And this will be revolutionary for sexology for women and for gynecology for women because, as I indicated before, I mean, postmenopausal women will have the same risk that men do for cardiac disease. They lose their hormonal protection. But premenopausal women take drugs and that interfere with it. I mean, there are millions and millions of women in America who don't know what their natural sexuality is like because they're taking hormones and antidepressants. And what's the right dose? Should they be taking it? And then for postmenopausal women, testosterone therapy, I am an advocate of testosterone replacement therapy. I mean, it took most of my medical career for just estrogen replacement to become acceptable. But what hormone is missing postmenopausal? Testosterone. It's a game changer for women because, I mean, Steph, you're young, but, postmenopausal women commonly complain that they've lost interest. I mean, it's my wife. The difference between, if I get turned on, I might be able to come versus I'm now confident that I'm interested. I'll initiate. That's a big difference. And so to take a woman in her 60s and to take her back mentally because of hormone therapy to the sexual attitude of a woman in her 30s. Hey, I like the fact that my wife now thinks I look hot getting out of the shower. It's a difference. And this is going to be, and of course now with a device, women will be able to say what the right dose is because that's the other problem with testosterone replacement therapy for men and for women. So for men with testosterone replacement therapy, the doctors are supposed to ask three questions: how's your energy? How's your sleep? How's your libido? Well, everyone wants more energy, right? What does that mean? What does that mean? I don't even know what it means. Everyone wants more sleep. Everyone wants to sleep better. And libido needs to be quantified. What does libido mean? It means something to you, Jason, very different than to me to Stephanie. I like to make that objective. For me, the question is, how many times a week are you now initiating sex with yourself or with a partner? And what's your goal? Obviously, someone says, well, I'm not initiating sex at all, but my goal is 10 times a day. I can't help you. But if someone says, well, I'm initiating sex, 2 or 3 times a month, and my goal would be 2 or 3 times a week, and my testosterone is low, male or female, that's a goal. That's achievable. That can be quantified.
Is there anything else that's worth bringing up that you want us to know?
Yeah, I think that we live in this incredible age of healthcare wearables, smartwatches, smart rings, and there's a gap, and that gap is sexual health. And what, frankly, is more important to almost everyone than their sexual health? And their sexual health is also a reflection of the cardiovascular health and the impact of medications they're taking.